Story that came out on the Register Guard, August 19th, 2018. I want to thank one of my subscribers, JG, for this article. Oregon sees a spike in synthetic opioid overdose deaths. Drug overdose deaths from highly addictive synthetic opioids include fentanyl soared last year in Oregon, according to preliminary estimates from the Center for Disease Control and Prevention released last week. There were 87 predicted deaths in 2017 compared to 42 deaths the year before, a 107% increase, the figures show. Fentanyl is a powerful painkiller. Yeah, they always say that in every single article. So we know it's a cheap import that comes out of China, that comes into the United States, that right now is just coming in almost like it's free fall into the country. The surge in deaths from synthetic opioids helped drive the estimate number of drug overdose deaths nationally to more than 72,000 in 2017, a new record high, and a 9.5% increase from the previous year. In Oregon, there were 537 predicted overdose deaths reported last year, and a 6.5% increase over the prior year, according to the CDC figures. The CDC cautions that the figures are early estimates based on monthly death records reported to the federal agency. The CDC adjusts the figures to correct for underreporting. See, they do a lot of underreporting on this plague, since some recorded deaths still are pending full investigation. The Oregon Health Authorities hasn't released its 2017 numbers, as it only includes deaths after an investigation has been completed to determine cause or manner of death. Hedberg said there's a task force currently looking at ways to reduce deaths from synthetic opioids. Recently, federal funding has become available to specifically curb illegal fentanyl. So there's been more collaboration between officials from public health, law enforcement, and emergency management. We haven't had a concerned and concerted effort for very long yet, but these numbers are alarming. Hedberg said the state also is seeing a concerning increase in deaths from methamphetamines. The state made a push years ago to crack down on meth labs and ban over-the-counter access to pseudoephedrine, a key ingredient to make meth. But you know what? I thought most of them are now getting their meth from Mexico because it's a more, it's more pure than the stuff that they were making in meth labs, that, houses that they made into meth labs. Okay, we're wondering if part of it is since the prescribed opioids are being locked down a little tighter, and now some of that is less available, that might be causing people to turn to methamphetamines. We're not sure. We're monitoring and concerned, she said. Between 2012 and 2016, Lane County averaged 50 drug overdose deaths a year, according to a state database that compiles information from death certificates. During the same period, there were 13 deaths from synthetic opioids, not counting methadone, that is used to treat opiate addiction, according to the database. Oh, well, It seems like it's rising everywhere. I did a story also on how it's rising in Texas. So it's going up everywhere. And as long as the drug is readily available on the streets, the addiction will always be there too. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you all on the next video. Peace, family.